The wait for a COVID-19 vaccine for the millions of infants and children under the age of 5 is finally over. And for the many parents and caregivers who have been working hard to shield their children who weren't protected from getting the virus, there is likely a roller coaster of emotions, including relief, concern, and maybe even a little hesitation. To address their concerns, we've invited a local Stamford pediatrician to talk to us about some of the pressing questions regarding COVID-19 vaccinations for infants, toddlers, and preschoolers.
Joining us for this timely topic is Dr. Barbara Allen. Dr. Allen is a board certified pediatrician providing treatment and healthcare services to children ranging from infants to young adults. Her practice is located at Rainbow Pediatrics right here in Stamford, Connecticut. We are fortunate to have her here today to talk to us about the youngest age group to gain access to the COVID-19 vaccine. Welcome, Dr. Allen.
Well, thank you for inviting me to speak about this much awaited vaccine that many parents have been asking about.
We're so glad that you're here. And to get us started, Dr. Allen, the Centers for Disease Control and Prevention approved vaccines for the youngest children. And now that they're available, many parents, caregivers, and guardians are feeling anxious and likely have some concerning questions. For example, we are now more than 2.5 years into the pandemic, which means some of the kids in this age group have already had COVID. If a child has had it, should they still get the vaccination?
Yes, it's been much awaited. And even if your child has had COVID-19, it is recommended that they do receive the COVID-19 vaccine. In addition, if you have serious questions and doubts, I recommend that you speak to your pediatrician, who I'm sure you have confidence and faith in.
Absolutely. Well, that's good to know.
And good advice.
If kids get the vaccine and then are exposed to the virus, do they need to be quarantined? I mean, should parents and caregivers keep them home from daycare or preschool?
It depends on the circumstance. When you say if they've had the vaccine, if they've been fully vaccinated, meaning they've had 3 doses of the Pfizer and 2 doses of the Moderna vaccine, then no, they would not need to quarantine. However, if they're in the process of being vaccinated, then since they are not fully vaccinated, they should quarantine.
And just to clarify, when you said 3 doses of Pfizer and 2 of Moderna, that's just the course of treatment for the vaccination, depending on which manufacturer you use, right?
Yes,
Okay.
there is a difference in the number of vaccines that are needed. Pfizer, you require 3, the Moderna, 2.
Okay, got it.
Perfect. A recent Kaiser Health poll found that only 1 in 5 parents and guardians are planning on getting their young children vaccinated immediately. However, there are families that are planning to hold off in doing so. Dr. Allen, what do you say to parents or guardians who may want to wait to give their child the COVID-19 vaccine?
I don't think they should wait. I think it's a good idea to get their children protected as soon as possible. And again, if they are hesitant, they should definitely try to speak with a trusted physician who usually sees their children. I hope that they understand that going to their primary care provider as a source of information is the best thing possible. Hesitancy can be expected, and I understand full well while some people might be concerned, but I think the vaccine should be given.
That's great advice.
It is.
Thank you, Dr. Allen, for joining us today. We are sure that anxious parents and guardians throughout Stamford are breathing a little easier thanks to your expert information.
And listeners, as a reminder, all the free clinics here in Stamford offer the vaccine for children ages 6 months and up. You don't need an appointment or insurance to get yourself or your child the COVID-19 vaccine. For the vaccine clinic schedule, visit stamfordct.gov.